Hi, I'm Harvey Target of Block 44S, and this is my curb video. So curb is found around this sort of area on the hock, just on the back. So it is a sprain of the plantar ligament. So it's shown in the hock as a swelling on the lower medial aspects, obviously lower medial aspects like here, so on the inside. So just come round and then it's here. It is soft tissue damage on the calcaneus. As like a sign, it would usually be shown as heat and swelling, and then pain from the horse. The horse would be uncomfortable. There might be gait change or lameness. When we're diagnosing it, it would be diagnosed with an ultrasound, as it's soft tissue damage, so the ultrasound can pick up the damage. The sort of causes of it, hyperflexion of the limb, so usually quite common in like sort of sports horses, show jumpers, where they're doing a lot of sort of pushing off and hyperextending it, and then when they're coming in land, their foot sort of twisting and just shunting that joint, so shear force is going through the hock. It can also be seen on like riding school ponies, because again they're always on a surface going round, they can do a lot of twisting and turning. Also the main sort of one is polo, because of the tight turns, so the hock's obviously always real tight and turning, so this hock is going to be moving, there's not that much give in it, so that's causing that strain and that tears the ligament. So a vet treatment would be NSAIDs, so that's non-steroidal anti-inflammatory drugs, so that would be their first sort of protocol. That's more on the acute stage, and then sort of box rest of the horse, return to maybe a little bit of activity after that, sort of building up slowly. As farriers, you're going to want a shirt with a bit of lateral support to help support that joint, and also to help footfall of the limb, because it's obviously coming in, so you're trying to make it go out again. Again, if it's work on a surface, you might want to put a plain stamp shoe on to reduce the shear forces, or a 3/4 footed shoe, but more towards plain stamp, because it's going to literally give it a little bit of slide, because it needs a slide, so it's not having the slide, so it's jarring, so you want it to slide a bit. So on the road, it's slide on a surface, it's not going to sink as much into the surface and give that jar, so it's going to glide across the surface instead. And obviously, yeah, just prognosis is usually good, but there's going to be an obvious condition there. It doesn't really go away, but you can help the horse be more comfortable and you can manage it. And then owner management would just be to give any drugs given, make sure the horse's activity, you're not taking it back to full activity, you're just building it up slowly. Thank you.